Hi, Joanna here. Today I am going to make a video on how to do some blood sampling and a needleless connector replacement with the PICC line. Okay, so I'm joining two tasks together. If you wanted to do the tasks separately, you do have the separate checklists available to you. All right, so regardless, I am going to follow the first few steps. So I review the patient health record and allergies, perform hand hygiene, which I'm doing right now. And this could be with alcohol-based hand rub or with soap and water, as you know. And I have my supplies ready. So I like to have everything set out in front of me because I don't want them to wait for me while I gather things. What I'll have is my 4x4 sterile gauze ready and my swabs to clean the port. Then I have my syringe, saline, everything set out. So it also is a prompt for me to know what to do next. Now, I gathered my supplies, identified my patient, and explained the procedure. And the patient does confirm that they are agreeable to proceeding with the task or intervention. Just make sure that they're comfortable during the procedure. I've cleaned my work surface with a cleaning agent already before the patient has sat down. I also already have my PPE, so my face shields in case there's any splashes, and my mask as well. All right, so what I'll do is my hands are clean and I'm going to put my gloves on. And we'll see what we have here. So every time you work with the PICC, you want to see how it looks like, how the insertion looks like every single time, just for assessment's sake. And it does look like this patient's PICC line, the internal lumen is out a little bit. And as we know, it's not too concerning if it's less than 2 centimeters, but anytime a lumen is migrating out, you want to note that and also ask how the patient is feeling. Okay, and then I'm noting as well the skin around the site. So I'm just going to take down the gauze here. And this is not necessary for the care of the PICC, but this is really for the patient's comfort. And the garbage is right beside me, as it should be, okay? So now I'm going to take the tag off that tells me what exactly is locked into the lumen, and I could just rip that off. Okay, so the different parts, as mentioned, the internal lumen, and this is the hub with the suture wings. It's attached to the stat lock underneath the whole tegaderm here. And then you have the external lumen, the clamp, and this is engaged. So we know that the patient is safe in case the cap is off. This is the port, and this is the cap or the needleless connector. All right, so our next step, I'm going to wash my hands now that I'm going to be touching the supplies. And if you're ever wondering if it's the right time to wash your hands, just wash your hands. You can't wash your hands too much, okay? And again, I'll re-don my gloves. So I have my sterile gauze handy here. Okay, and I'll have that on standby. So what I want to do now is get ready for some blood draw. So I have 2, it might be good to use 2 just because I don't want the cap causing any breaks in the swab here. So the amount of time or minimum amount of time that I want to scrub this cap for is 15 seconds. And I literally do count in my head 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000, 7 1,000, 8 1,000, 9 1,000, 10 1,000, 11 1,000, 12 1,000, 13 1,000, 14 1,000, 15 1,000. So that is sterile only until it's dry, because it needs to dry as well for it to sterilize. Now at this point it depends on how the PICC line sits, and this patient's PICC line sits kind of to the side here. It's kind of in the air, so I know it's going to stay sterile, but sometimes patients' PICC lines, depending on where it is on the arm, might be sitting on top of their arm. So put the sterile gauze underneath, and that will increase your sterile field, so you have you could ensure that the cat remains sterile. So we wait until that completely dries. Now we do know that this PICC line is locked with a solution. So the first step is we want to remove that solution from the PICC line, right? So you open up your syringe or the packaging and make sure that your tips are sterile, okay? And you grab onto the port there and you screw it on. Now you disengage or undo the clamp and you withdraw fluid. Now we want to know how easy it is to aspirate this blood, or how difficult. We have to chart on that. For me today, this blood is withdrawn quite easily, and we withdraw the same amount of locking solution that we infuse in. If it's a little bit more, that's okay, not too bad for the patient. Okay, so now we want to attach a saline syringe to give it flush. And notice that I do keep my syringe on my cap, just because that's an easy way to keep it sterile. Now I want to make sure that I get the bubble or the air out. Okay, and then now we place this in the sharps container. Okay, keep my tips clean and then screw that on. Okay, and then undo the clamp again and then flush. The protocol actually says they want us to slowly aspirate, which we can do as well. You don't even have to aspirate into the syringe. You could just aspirate into the external lumen here, and I am having no problem still with aspirating and no issues with flushing. Now, if you do come into problems with flushing or aspirating, you could ask the patient to turn their head and cough. They could raise their arm. You could try a few different positions to aid in that, okay? All right, so protocol says that we flush with 20. So again, I take the air out of the syringe and I keep my tips clean and sterile, discard that, and flush again. So notice once I finish aspirating or withdrawing, I always clamp, and my fingers are always on the clamp here. I do note that there's a little bit of a bubble there, so I know not to infuse this last section because I want the patient safe. All right, so we do know now that the locking solution is out and it's flushed with 2 10 cc saline syringes. Now we want to make sure that the lumen is filled with pure blood, because we do want to draw blood today. So again, we're keeping the tip sterile by leaving the syringe on, and then now I take another syringe. Now protocol says that for PICC lines, we withdraw at least 6 milliliters for adults. So again, we keep the tips clean, and I'm always cognizant of where this tip is and where the port tip is. Okay, and you just screw it on and we withdraw 6 cc's. And there's usually going to be a little bit of an air bubble, so you could draw back up to maybe even 7 to account for the air bubble. Okay, so now we have withdrawn that, and at this point, if you want to get a blood sample for, say, blood glucose, you could take this off, and we'll just do it right now. Attach the 1 cc syringe, because we want to not waste the patient's blood either, right? So again, we put this into the sharps container, and then keeping my tips clean, screw it on there. And you don't need much, you know, that is equivalent to just a prick in the finger there, and that should be enough. Okay, so now we are ready for the vacutainer. Now this blue tip here, you need to keep that sterile. That's just like all the other tips of the syringes that we're using, right? So we can unscrew that, and it does take a little bit of dexterity for sure. If for some reason it slips, your hand slips, you could always re-sterilize and get new supplies, okay? So that is ready for you to draw blood. Now what you want to do is undo the clamp again and stick the vial right into the vacutainer. Now this is covering a needle right in there, okay? And all you have to do is stick the vial right in, you push it in, and see, it just fills up. You don't have to twist it, you don't have to pump it, whatever. You just push it in and then you take it out. And you don't really have to clamp at this instance. You can if you want, but you don't have to. And that needle is clean or sterile because it's within that vacutainer there. So your pure blood sample is ready to go, and then you could give that to lab. Now what we want to do is flush the line. We want to make sure that there's no blood sitting in there. So now that you're done drawing blood, you take a new 10 cc syringe and make sure that the bubbles or air is out, and then you unscrew that. Now because there is a needle here, do not throw it into the garbage. This goes into a sharps container. So now you keep your tips clean again, or sterile rather, and then you screw that right onto there. Oh, and I should have had my clamp on, and I'll just undo that there and flush the line. Now, say I did forget, like I did, that's okay because the cap is still on, okay, and the patient was still safe. Okay, so now that we have cleaned it with 10 cc's, one 10 cc syringe, we want another one as per protocol. So we also want to change the cap. We want to get our supplies ready though, because we don't want the tip of the port exposed for too long. So we open everything up here and everything is sterile. We unscrew that. This is all sterile, and we could get the air out that way, or we could have just screwed that right on, and you can see the fluid coming out here. Now this tip is sterile because of this cap, and we could just lay it down there in preparation for when we need it. Okay, and see how easy it is just to go down the line once everything is prepared and set out. So now protocol says that we need to clean the junction site between the port and the cap. So again, I'll just use two because these are tiny, and we just clean the junction site. 1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 6 1000, 7 1000, 8 1000, 9 1000, 10 1000, 11 1000, 12 1000, 13 1000, 14 1000, 15 1000. Okay, and leave that there, and we have to let it dry. Okay, and then once you let it dry, and it does take a few seconds, so you could talk to your patient, see how they're feeling, how they've been tolerating the PICC line, if it felt funny once you aspirated the blood or infused any of the saline, that's fine. So once that is clean, then you can take off. So now this is really important, make sure your clamp is on, because we're going to take off the cap now, and blood could start coming out if the clamp is not engaged and the cap is off, but it's not an artery, it's a vein. So we'd do so slowly, but just for safety's sake, make sure that your clamp is engaged. So you unscrew both the syringe and the cap, and you could just discard that. And this is where you want to get one, and then two. You don't need to, but it's nice to make sure that you have a good cushion. And then you clean the very tip of this. And you should get the threads too, because sometimes there's dried blood on there. Okay, so again, 15 seconds. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000, 7 1,000, 8 1,000, 9 1,000, 10 1,000, 11 1,000, 12 1,000, 13 1,000, 14 1,000, 15 1,000, and allow it to dry completely. Now for me, I like holding on to that because you really, really do not want this tip to touch anything. If it does, just make sure that you clean it again, 15 seconds, okay? But we've been pretty good. We haven't been needing the sterile gauze, so we're almost to the end of the procedure here. Might as well just hold on to it, okay? And then after that is dry, then we take the new cap and we remove the blue end of it, okay? Now make sure these tips are clean, this one and this one, and we just screw it right onto the threads. Now make sure that it's caught on the threads so it's screwed on properly, or else it'll be loose if it's not caught onto the threads properly. Okay, and then you could open it up there and give it that second 10 cc normal saline flush. And just note throughout the whole procedure, I have been using this pulsatile technique because it is a good way to clean the whole internal lumen, or the whole lumen. All right, and finally, we want to put the locking solution as ordered. So check your syringe, make sure that it is sodium citrate, which it says right there, sodium citrate as ordered. And then just take out the air. And sometimes you do have to pull back because it gets a bit sticky. And then it's 3 cc's. Okay. And keep your tips clean once the syringe is off there. Okay. And screw it right on there. Okay. And undo your clamp. And you just use the same pulsatile technique. Flush it in, and then the last little bit, when you push in, clamp it, and then unscrew it, and then you're done. So lastly, you'll want to date and initial the sticker of the sodium citrate, okay, and then put it on to the cap there. And I always put it on the cap and not this portion, because you change this cap all the time. You can't change this portion, and sometimes with the adhesive on the sticker, it starts to gum up, and then people won't be able to read the writing here. It's not as clean as it should be. Okay, so once that is all done, then I could get some gauze. And again, you could just leave it like that for the patient, but my patient likes to have a little cushion, especially with the clamp. Sometimes it adds a little pressure onto the arm here. Also too, whenever you unclamp or clamp, you could move the clamp up or down slightly. We don't have too much room to work with here, just so that you could avoid any huge kinks in the external lumen here. Okay, so once that is all taped up, and then this is good too, so that if they are to go anywhere and someone were to access their central line, they'll know exactly how much of what kind of fluid is infused or locked into the PICC line. So when I tape it, I just tape a portion of the gauze. I don't wrap it around because I want to be considerate of my colleagues accessing the catheter after me. It makes it a lot more difficult if I wrap it around several times the tape around the gauze. Okay, and then just depending on patient comfort, you could tape it right onto the patient. You could move it to the side, just make sure that this isn't kinked, and then you could secure the line like that on their arm. And that is how to draw blood and how to change the needleless connector.